Hi guys, welcome back to my channel. I'm Chocho and I'm a health personal. Thank you so much for coming back. You see people having stroke here and there, like sometimes our family members and all that. It just don't happen. It happens with time. That's why people term some blood pressure that doesn't give signs and symptoms as a silent killer. This increased pressure can cause a wear and tear in our endothelial cells. It comes by because these endothelial cells lines our blood vessels. Yes, they give them that thickness in the cells. And when there's wear and tear or there's increased pressure in the blood vessels, they end up having some cracks that prevents or hinder blood flow in the proper way and creates some increased fluid at one particular place or the other, and this brings about the hypertension. Not only stroke, but you can get aneurysm, myocardial infarction, all coming in here, and they are serious health problems. I don't want you to get one. I don't want your family members to get one. So make sure to seek medical advice on time. Strangely, hypertension is on the rise. Like, it's a cause for alarm due to some hypertensive crisis in recent times. And hypertension, funny enough, just has two numbers. Yes, the diastolic and the systolic. The diastolic is when the heart relaxes, whilst the systolic is when the heart contracts. The hypertension is normally measured at the brachial artery at the upper arm. And this is because when the pressure in the artery there is high, it's probably high throughout the whole system. Normal range of blood pressure is mostly 120 millimeter of mercury, whilst the diastolic of 80 millimeter of mercury. An increased rate of 120 to 129 millimeter of mercury, whilst the diastolic of 80 to 89 millimeter of mercury falls under stage 1 elevated blood pressure. Then, an increased rate of 140 millimeter of mercury to a 90 millimeter of mercury falls under stage 2 of blood pressure, elevated blood pressure. An increased rate of 180 millimeter of mercury to 120 millimeter of mercury as a diastolic, it's hypertensive crisis. There are no clear causes to hypertension, and they are termed as primary hypertensions. These primary hypertensions develop with time, and they have risk factors like obesity, sedentary lifestyle, old age, and yes, heavy salt intake. Yes, you are prone to having hypertension if you do those kind of stuff, if you fall in that category. Yes, while a secondary hypertension always has an underlying cause. It could be through a renal problem where there's atherosclerosis, vasculitis, or aortic dissection. The kidney has a big significant role to play in regulating blood pressure. Make sure you take care of your kidneys. Yes, guys. So when there's not enough blood flow to the kidney thereby secretes an hormone called renin, and this renin causes water to be retained in the body, like in the blood vessels, in the arteries. This later increases blood volume or increases fluid volume in the whole blood vessels, leading to hypertension. Yes, as simple as that. So you need to take care of yourself. Like, make sure you do a regular checkup if you have already seen certain signs of hypertension, or you have an increased blood pressure, a consistent increased blood pressure within a week. You need to seek medical advice. A tumor also can cause an increased fluid volume, just like the renal issues, and they produce aldosterone. Aldosterone is similar to renin and also can cause fluid retention. Hypertensive crisis, most often the systolic is greater than 180 millimeter of mercury, whilst the diastolic is greater than 120 millimeter of mercury, and that is the danger sign. So with hypertensive agents, there's no damage to the organs, yes, but with hypertensive emergencies, there's evident damage to the organs. Confusion, breathlessness, chest pain, and drowsiness are mostly signs and symptoms of hypertensive emergencies. Best medicine to give yourself as a person, as an individual, is to eat properly, like your dieting, exercise, reduce stress, and change certain lifestyles you know, yes, you know it's a problem to your health. Although most often antihypertensives are then given when there's the cause for alarm in some cases, yes. So this is all that we are discussing today. Thank you so much for watching. Please like, comment, share your thoughts, and let me know if this video really interests you. Thank you so much.